All right, guys, we're going to get started now. Hi, welcome, and I'm so glad that you're all here today to fight for healthcare, which is a human right. At least it should be, right? Yeah. My name is Jenn Coffey, and I am from right here in the Queen City. And I've had to take my story public in order to force my insurance company to approve life-saving care. This past April, we launched a campaign targeting United Healthcare. The goal was to get them to actually pay for my infusion to treat complex regional pain syndrome and small fiber neuropathy. CRPS is also known as the suicide disease. It knows no age limits, and it has taken the lives of children and Olympic athletes just the same. I acquired it through breast cancer. For the last 5 years, I've struggled to cover the full cost of my infusions and multiple medications, on top of my United Healthcare, Medicare, disadvantage, health insurance premiums, copays, and co-insurance. Like many, my rent went up $400 last year, and the money had to come from somewhere, so the solution became rationing my infusions. Two groups jumped in to help me: Rights and Democracy New Hampshire and People's Action. They created and shared videos I agreed to make, taking some of the worst moments of my life and putting them on full display. They created a petition and gathered 4,000 signatures. Our goal was to get United Healthcare to talk to me and try to work out a novel idea, actually covering my healthcare costs. I've learned to manage my life by making trade-offs, sacrificing one thing in order to do another. It's hard enough to balance it all without having to spend hours on the phone fighting for the care that I need to live. United Healthcare continuously screws my doctors. How are they supposed to pay their staff who assist them and monitor my vital signs while I'm under sedation if he's not getting paid? I honestly feel like I'm in a battle for my life against United Healthcare. Oh, I do feel like I'm battling them. People are dying every day in this country waiting for approvals of what could have been life-extending treatment if only they were granted access. After the first day or two of the initial campaign, United Healthcare did reach out to me. Within a week, I had a very excited service coordinator telling me my infusion was improved, and I was granted one office visit and 1 hour of infusion. The doctor's office was still working on approval for the other 3 hours of infusion, along with the common medications and fluids needed. Just weeks away from infusion, I was suffering with a flare. I called to find out about moving up the infusion. They could, but there was a catch. The doctor's office can't get United Healthcare to approve the tools to administer the infusion, like normal saline or even standard vital sign monitoring. Unbeknownst to me, they had been trying to get approval since the prior authorization was granted. United Healthcare also refused to cover the 4 hours needed to infuse me. They had approved exactly 1 hour. Administering it that way would kill me. So back on the hamster wheel I go, off to file another appeal, begging United Healthcare for a treatment. Then it's up to another 60 days of waiting for the insurance to decide if they'll let me get care or if they'll lock me out. What am I supposed to do with that? How do they expect me to be able to live and function when I need an infusion now, not in 60 days? Then I asked Senators Hassan and Shaheen for help. I even went to their offices in Washington, D.C. I've had meetings with members of their staff asking them for help. These private, for-profit insurance companies are not operating like Medicare, and they shouldn't be allowed to trick people into thinking they are.
Yeah.
Right on. The senators did get more attention. Things started moving, and it looked like everything would be approved, and they did, for the wrong date. They approved the request of the date it was filed, not the date of service. The new prior authorization had everything that was needed, so I figured they just had to fix the date. It seems so simple, right? Well, I spent the next couple of weeks trying to get in touch with the same people I had successfully dealt with before. I got voicemail after voicemail, and no one would call me back. The claim was processed, they didn't pay the doctor the right rate, and they denied parts of the claim. And there was a substantial amount left for me to pay. I have to contact everybody again. I have to say it all over again. I have to beg for it all over again. It's a simple mistake. All the insurance had to do was change the damn date. I'm told I need to go through the process again. I'm even chastised and accused of not being willing to go through the process.
That's BS.
What the hell do you think I've been doing? We started in April to get coverage for my July infusion. Now it's October and I'm still fighting. I just put in a request for a new prior authorization for the next infusion. It's obvious why only 1% of people actually try and appeal their denied claims. Consider this. After everything we've done, the social media campaign, the videos seen by thousands of people, over 4,000 signatures on a petition, along with 2 United States senators, and I'm still fighting United Healthcare.
That ain't right.
The law allows them to profit on my pain, and that ain't right.